So with this tutorial, we are starting a series of informed detailed tutorials that we are looking into, particularly with regards to that of questions appearing in embryology. In this series of questions, we will be looking at the most important ones as well as the most frequent ones that has appeared in previous examinations. So the first question that I chose was about fertilization. There are 5 statements, all true and false. We'll be looking at this in a very detailed manner. So the first statement says about usually fertilization takes place in the ample region of the fallopian tube. Now, as you know, if you can remember your the previous question as well as the some of the anatomical aspects of the female reproductive system, if you, there are the fimbriae, finger-like projections which actually identifies and gets holds of the ovum that is being released to the peritoneal cavity. Then it tunnels its way passed down via the fallopian tube into the uterus. Now, if you can remember, as I said, I've emphasized on this fact as a fact already. Usually, the fertilization takes place in the proximal part of the fallopian tube, in the ampulla. So, the sperm should already be present at the ampulla for the fertilization to take place. Fertilization is the mere merging of the sperm and the oocyte or the ova for the formation of a diploid zygote. Now, after the fertilization, it starts to divide, it starts to form a morula as well as a morula, which is morula and a blastocyst as well. The ball of cells comes and then gets implanted on the posterior upper wall of the uterus. However, there are instances where you see the implantation happening. So most of the time, the more frequently you see implantation happening outside that of the uterus, which are known as ectopic pregnancies. However, the most frequent location would be at the point where the fallopian tube passes into the uterus. This, even though this is a form of ectopic pregnancy, most of the time what you see is that this usually moves in a way so that it comes back to the uterus. However, if it retains within the fallopian tube or anywhere else, it could either be the fimbriae or sometimes the oval itself or sometimes even the peritoneal cavity. This is termed as an ectopic pregnancy and has to be removed because later it will cause complications because of the fact that it will not be allowed enough circulation to pass into the growth of the zygote, and therefore there will be ischemia and leading to other complications. So most of the time the where you see the ectopic pregnancy is at the distal part of the fallopian tube, the point at which the fallopian tube passes into the to the uterus, right? So the first question usually occurs in the ample region of the fallopian tube is a true statement. Results in the restoration of the diploid number of chromosomes. Now that is very uh, easy and straightforward as well, because what happens in fertilization is where two is a unification of two haploid nuclei, one from the sperm and one from the ova. One thing that is required to be remembered is the fact that at ovulation the ova has not completed its meiosis and usually present within the prophase. However, with at the at the initiation of fertilization, what happens is the with the acrosomal reaction and the proceedings, what would happen is that the ova will complete the meiosis and will form a haploid nucleus with a polar body. The haploid nucleus will unify, will merge with the sperm's nucleus and will form a diploid zygote. So this is a true statement. The statement C is about the penetration of the zona pellucidea. Now, again, if you can remember the anatomy of the ova, there is a layer which is known as the zona pellucidea, to which the sperm will bind. Once the sperm binds, there is a small modification of the sperm which is known as the acrosomal reaction that will uh, in fact this is a process where the lysosome that is found in the tip of the head merges with the membrane so that it allows the sperm to pass through via the zona pellucidea and into the cytoplasm of the ova so that it can carry out its fertilization. However, without the acrosomal reaction, there will be no fertilization. So it is something very important and paramount. So acrosomal reaction happens and then the fertilization takes place. One thing that has to be said is that sometimes there are few clinical conditions that might have an implication in the acrosomal reaction, and the acrosomal reaction itself would be defective. In such circumstances, usually there will be subfertility in the respect of the male. So some prefactor defects in the acrosomal reaction can cause male infertility. This might secondary be due to few conditions that might have associations with immunological or autoimmune conditions, sometimes with genetic disorders that lead to the formation of defective sperms that do not have uh, ideal acrosome for the reaction to take place. And also sometimes it is associated with cryptorchidism, where you see the testes have not descended into the scrotum, a congenital form of a disease. If this persists for a longer period, the sperms that are produced will not be adequate as well as not be very not have the ideal structure. So there will be sperms that are produced not of the good quality, and there are also certain conditions that are associated with azoospermia and teratospermia, especially teratospermia, where there is the production of abnormal sperm morphology with problems or defects in the acrosome so that the acrosomal reaction will not take place. So in these conditions, what would happen is that there is a possibility that the male individual will face a form of a infertility. So to overcome that, there are methods that can be utilized. One would be, now there is a process that we can utilize for the fertilization. If it is not possible, we can do it in a clinical perspective where the ovum as well as the sperm can be taken into a petri dish and allowed to fertilize. This is known as in vitro fertilization. However, in vitro fertilization is not plausible because of the acrosomal reaction not happening in the ideal manner. So in such circumstances, what we employ is a process which is known as cytoplasmic injection of sperm, where even conditions that are associated with defective acrosomal reaction can lead to uh, fertility and the production of a progeny. So penetration of zona pellucida is prevented by, actually it is the opposite. It is a false statement. The acrosomal reaction is the one which enhances penetration as well as the fertilization. Without it, it will not happen. Triploidy is a result of fertilization with 3 sperms. Again, a false statement. Now, if you look at this, triploidy, most of the time what students usually get confused is with the trisomy. Triploidy is a condition where you see 3 sets of chromosomes. Triploidy, you see 3 sets of chromosomes. So ideally 69 chromosomes in total. But trisomy is a condition where there is non-disjunctioning of a single chromosome and you get triplets triplet of a chromosome at a certain location. Yeah, for an example, if you think about Down syndrome, there's the trisomy of the 21st chromosome. However, in triploidy, this individual that is formed, or the fetus that is formed, will not be viable. Usually, there will be miscarriages or abortions, and usually this fetus will not reach the term. Hence, most of the time you would in certain circumstances where you see preterm bleeding, miscarriages, you might come across such conditions where there might have been a trisomy. Now, you might ask me why such conditions are possible. It's something to do, most of the time there are environmental as well as genetical conditions that are related with this. Sometimes it might have a few associations with advanced maternal age. With with increased time, sometimes there is a higher chance or a risk for a triploidy to happen. And also it is sometimes associated with assistive reproductive treatment, where there is certain methodologies that are utilized for fertilization or for conceivement, such as in vitro as well as intracytoplasmic injection. In both circumstances, there is a possibility that it will lead to triploidy. And also sometimes there are parental chromosomal abnormalities that are associated with it, and some even environmental and parental causes. So overall, if a triploidy happens, there is a possibility that most of the time it will not reach the term and it will not be viable. It will undergo a miscarriage. This can be identified through via ultrasound scans. There will be deformities, there will be structural deformities, there will be organ deformities as well. And also sometimes there will be differences or changes in the volume. There could be excessive water in the uh, excessive water within the embryo, which is known as polyhydramnios, or could also be reduced like as well. Right. So ultrasound findings are again something that can be utilized to identify such conditions and may be associated with IUGR, which means that there's intrauterine growth restriction, and also sometimes hydrus fetalis. Hydrus fetalis is a condition where you see abnormal fluid accumulation within the fetal body cavities. Now, furthermore, these are the investigation findings. Sometimes this triploidy is not all triploidies, but most of the triploidies are associated with a condition which is known as partial molar. pregnancies. What are partial molar pregnancies? This is a condition where the ovum is fertilized by means of two sperms or dispermy. Not usually seen because once a single sperm gets bound to the zona pellucidea and carry out a reaction, and once the fertilization takes place, all the other sites which are viable for the or eligible for the other sperms to get bound on will be destroyed. Hence, dispermy is not typical. But there are certain circumstances or certain instances where you see dispermy and seeing a triplet of a chromosome. So a triploidy. This is different to that of complete molar pregnancies. In complete molar pregnancies, you see the absence of the haploid nucleus of the ovum, but there is there are two sperms that are coming out. There is this unification of two sperms giving a diploid zygote, but this is not viable completely because it is of the sex chromosome is composed of Y, two Ys. Again, not viable, but this is this condition is known as molar pregnancies. Both of these molar and the partial molar pregnancies are coming under a certain category of disease which we see in uh, obstetrics, that is known as gestational trophoblastic disease, and something that is you commonly seen in this condition is the presence of abnormally high levels of beta HCG in both circumstances. In both you have to either most of the time most of the time it will pass out without any intervention. There will be a miscarriage, but if there is retention of tissue, this has to be taken out by means of evacuation. So triploid is a result of fertilization of an oocyte with three sperms is false because it includes only in partial molar pregnancies, it is the unification with two sperms, a oocyte with two sperms, with three sets of chromosomes. Fertilization does not take place in vitro, again, a false statement. Um, in vitro fertilization is something that is being employed once once a normal process is not eligible for certain couples. So with this, we are concluding the first question. We have given a very descriptive answer with with all the possible details as well. So stay with us for this other questions as well. We'll be doing a series of questions explaining most of the important topics regarding embryology.